Hi everyone, my name's Alison Nelson. I'm the Director for Organisational Development at the Institute for Urban Indigenous Health in Brisbane, and I'm here today with Tracy Hill.
Yeah, I'm Tracy. I'm the manager of our academy at the Institute for Urban Indigenous Health.
And we're here today to have a bit of a yarn with you about pathways into health careers for Aboriginal and Torres Strait Islander young people.
Yeah. So I guess what vocational education and training opportunities exist for Aboriginal and Torres Strait Islander students who are interested in a career in the health industry?
Yeah, I think this is a really good question, because I think sometimes we think that there needs to be separate opportunities, and actually the opportunities are the same for all people, including our Aboriginal and Torres Strait Islander students. But I guess the difference is maybe about some of the system barriers and enablers that make it easier or harder for some of our students to access. So some of those things might be limiting people in their choices. So, it's really important that we find what, like we should for all students, find what makes people tick and what gives them their passion and their interests. And often at the age that students coming into a school-based traineeship are at, they don't really know what they want to do. And I guess school-based traineeships are an opportunity to explore some of those things. So even if people aren't thinking, I'm really passionate about health, it's still a really great opportunity for them to learn some skills about work and to be exposed to an environment that they may or may not decide to pursue down the track.
Yeah, so it's having that whole holistic care approach into what is health, but also not limiting them to just specifically the health industry within the clinic. Actually, what is the health environment? It's not just a clinical or hospital setting, but it's also community settings as well.
Yeah, absolutely. And I think it's also about the mentoring and support that we need to make sure that we're giving our young people as well, so that they're not just sort of thrown in the deep end, but they're given mentoring and support. We're talking with them, we're coaching them through some of those professional behaviours that you need in the workplace as well, like, making sure you're communicating well and you're letting people know if something's come up and you can't make it to work, and some of those really simple, or what we think are simple things, but maybe aren't sort of things that people have had a lot of exposure or experience with.
Yeah. Nice.
So what about, you started to talk a little bit about some of those health careers and health career options. What are some of the things, you talked about hospital and community, what are some of the other things, areas that people might be able to work in?
Yeah, so I guess within health, it's not just being, a nurse, an Aboriginal health worker. You'll have your allied health assistant or an allied health discipline. So it's more around, every health industry needs a receptionist. You need an administration officer, whether it's a practice support officer. Definitely, like we said before, a lot of assistance within allied health, nursing. So it's not just your qualification, going to university and getting a degree positions. There's all these other positions that without them, we can't operate. So it's about exposing our students into what is health, but also some of them actually might be our next receptionist, our next admin officer. So it's actually giving them exposure to all those fundamental skills that you actually need as well, not just the observational skills as well.
Yeah, great. And I guess there's lots of examples in our workplace about where we've grown people from a school-based traineeship into other positions, whether that be now a practice manager or we've got people in our communication and marketing team who started off as a school-based trainee but in allied health assisting. So it's a nice, I guess that school-based traineeship pathway is a really nice entry pathway, isn't it, to then be able to get a job and then find out where you want to go and what you want to do, and pathwaying them into university study or into further work opportunities and looking at where you can grow into as well.
Definitely, yeah. And I guess, there is identified roles as well. But again, we can't limit our students just to apply for those identified roles as well. We want to, like we've been saying, we want to expose them to as much as possible, because if you're limiting students to just one position, then you're not actually growing them at all. So you actually need to give them the experience, expose them to as much as possible, right from transport all the way up to managing. So all those different roles you want to expose them to, so then there is other opportunities, not just one stream of opportunity.
Yeah, that's so true. And I think, we've now got Aboriginal occupational therapists and speech pathologists and podiatrists and exercise physiologists. So it's really nice to see the way in which people have grown into different roles and different professions, and they're now role models for some of our school-based trainees to be able to aspire to doing something different as well.
Yeah. And I think that's it. It's around having those leadership roles, and those ones who do identify coming back and yarning to your vet students, yarning to your school-based trainees around how their journey and how they got to where they are, because they all started off either with, whether it was a school-based trainee, either they went to university, or maybe sometimes they didn't go to university straight after school and they didn't do a vet qualification, but they've come back and then studied it through. So I guess that's the exposure you need to give to the students as well, so they understand what opportunities they have, because a lot of the students, their journeys might not be linear, might not be A to B. It might actually be, you know, they're tracking along well, and then the priority is not to become the next health worker. The priority actually is, I actually just want to be a receptionist. And then they think around being a receptionist, they're exposed to so much more, and then they might build the confidence enough to go into nursing or whatever their preferred pathway was.
Yeah, that confidence is so key, isn't it?
Yeah.
I was thinking that as you were talking, that often that's part of the journey, is growing enough confidence that I believe that I've got the self-belief that I can actually do something different, or I do want to give study a go, or whatever it might be.
Yeah.
And you're a really great example of that yourself, aren't you, Trace? So tell us a little bit about your journey into the role that you're now in terms of being an academy manager.
Yeah, so I started off at school-based as well, through an Aboriginal group training organisation. So I actually did a school-based traineeship at the bank, ANZ. You know, it was an Indigenous organisation. I got the wraparound support from an Indigenous organisation, and I did a Cert 3 in business. Now, I didn't know what I wanted to do then. I just thought, oh, I want to work at the bank. How cool is that? You know, so I decided to take it. It was a bit scary, but I had to do that. You know, not only did it allow me to go to school 4 days a week, because I wasn't finding school was for me either, but this actually kept me in school. By providing that assistance of a school-based traineeship and that vet qualification. I did that Cert 3 school-based traineeship at the bank, and then I became an admin officer for the next 3 years after school, after I left high school, and I knew my passion was working with youth. I always wanted to help youth, and that's when I started working in education. And then I continued that, working in education, and then I found myself working at the Institute in a health organisation, and I didn't realise until I started working here as a training mentor and a traineeship coordinator that this is health. You know, helping people, health is not just providing the care for someone, it's actually helping them with their social determinants and helping them overcome those barriers. So for me in this role now, I'm able to help these young students come through a traineeship program with us and help them overcome barriers of social determinants that they're facing. So now I look at health as more of a holistic care of, it's helping our students tackle those social determinants. It's not just going to a clinic and being a nurse, or, you know, going to a clinic and getting health care. It's all around the wraparound support and helping our mob, and in particularly our young ones, helping them build that confidence to tackle those barriers that they are facing.
Yeah, that's a great story.
Yeah.
But I also think it's such a good example of not only the growth pathway you yourself went on, but just that understanding of the importance of thinking about the social determinants of health, that it's not just about having great health care, but it's also about addressing education and employment and all of those things that we know have a big impact on people's health outcomes. And seeing it as a holistic thing. And also, you know, obviously we also have trainees who have health needs, making sure that we're not just focused on the education or the training, but we're also making sure we're plugging them into the sorts of support services that they might need as well. Yeah,
and I also think, you know, by providing that holistic care, but the wraparound support for your school-based trainees and students in the vet sector, it actually gives that confidence, but also you're connecting them back into their mob. For us, you know, a lot of our students are going through and connecting in with their communities and finding out who they are and what is their passion. It's really getting down to that, well, what's your why and what do you want to do when you leave school? Because some of them don't know, but if we can lead them into the right direction, support them through their journey, then when they do finish high school and finish their vet qualification, they have some skills, but also they have some knowledge on, okay, where do I want to go now?
Yeah, that's really important, isn't it? Like having that pathway beyond the school-based traineeship too. So we're not just training people for the sake of training or to tick a box. But we're actually trying to find pathways for people to explore their why.
Definitely.
And to then be able to get a job out of that at the end of it is so important. one of the other things that you just picked up then was that idea of connecting with mob, and I think that idea of working in an environment where it is culturally safe is really important as well. I think we've often seen people who end up in traineeship roles where they're maybe the one isolated Aboriginal and Torres Strait Islander person, and they don't necessarily have a happy time. So I think it's also really important to be thinking about the environment that someone's going into, and is it going to be a culturally safe environment? I know for us, you know, we're in the fortunate position that we have half of our you know, workforce are Aboriginal and Torres Strait Islander, so that makes a huge difference. But also that people can then see a pathway, so they come into the organisation and they can see where they could end up as well.
Yeah, definitely.
So one of the other questions I guess we get asked is, can Aboriginal and Torres Strait Islander people access particular government subsidies to undertake a vet qualification?
Yeah, it's exactly like all other students. You know, they are entitled to and they can access the government funding for school-based traineeships. So exactly the same way any other students have the opportunity to.
Yeah, cool.
Yeah.
And you talked a little bit about identified positions before.
Yeah.
So tell us a little bit more about what identified positions there are and how we sort of approach that.
Yeah, definitely. So there is an identified position called the Aboriginal and Torres Strait Islander primary healthcare worker. We call them Aboriginal Torres Strait Islander health workers, and they work in our clinics, and that is an identified role because it is important to have an Aboriginal or Torres Strait Islander person who does identify in that role. And that is by us doing a Cert 3 in primary healthcare or a Cert 4 in primary healthcare. Other than that, they're probably your main identified role. Like I said, it's anyone can work anywhere. There's no limiting our Aboriginal and Torres Strait Islander students into what role they can be. But that one is just for that cultural safe practices as well. We really want to ensure that in a clinic or in a health setting there is a identified role. You might have your identified liaison officers as well, who might go out within the community and liaise with the community, liaise with mobs, because that's really important around. You do want someone who does identify when they are yarning with mob, trying to promote health, healthy lifestyles or health promotion, and getting our mob into their healthcare setting as well.
Yeah, and it sounds like in both those roles you really want somebody who feels pretty confident already and has got some connections to that local community, because that's a key part of what that job's about. So I guess if somebody's interested in health but maybe doesn't fit that kind of mould, then some of those other pathways we've already spoken about might be a better fit for students. So we shouldn't just be thinking you're Aboriginal, so therefore you're going to become an Aboriginal health worker.
Yeah.
Or even just helping other people explore what other options are available outside of primary healthcare.
Definitely, yeah.
So there's certainly a lot of opportunities for young Aboriginal and Torres Strait Islander people to explore a whole range of different careers in health. And I guess part of what we would suggest is that the role of people working in schools is to help students explore what those pathways might be, and I guess not limit people just to the things that they know, but also really encourage them to explore the things that perhaps they don't have experience with or don't know, and trying to tap into some of those whys, I guess, of why you might want to be involved in a career in health. We certainly have a lot of students who talk about wanting to help mob or wanting to work with their older people because that's a really important thing for them.
It's definitely sitting down with the students and reaching out to the Indigenous organisations who are delivering the vet or have school-based opportunities, linking in with your own community to figure out what is out there for the students who can come in and have a yarn to our Aboriginal and Torres Strait Islander students.
Yeah, that's great. And I guess if people want more information, they can always access our website, which is iuih.org.au, or the Grow Your Own website or Choose Your Own Health Career websites as well. Thanks for the yarn, Trace.
No, thank you.
It's been really good to chat.
No, thank you.
We'll see everybody later.